Okay, hi guys, it's Bailey, and today I'm going to be talking about microcytic anemia and just the pathophysiology, what causes it, signs and symptoms, and how we can manage it. So what is microcytic anemia? So microcytic refers to abnormally small in size red blood cells, and anemia is a clinical sign of some abnormal condition related to a reduction in one of the following. So it could be number of red blood cells, amount of hemoglobin, or amount of hematocrit. So microcytic anemia is an umbrella term used to describe when the body has fewer red blood cells than normal, and the ones that it does have are a smaller size than normal, hence the word microcytic. So there are several types of anemias that can be described as microcytic. And basically how they characterize a cell as, or a red blood cell as microcytic, a CBC will show the mean corpuscle volume of a red blood cell, which is the average volume or size of an individual red blood cell, and this is useful for classifying anemias. And so when the MCV, the mean corpuscle volume, is lower than normal, then that classifies it as microcytic. So what causes microcytic anemia? This group of anemias is caused by conditions that prevent the body from making a normal amount of hemoglobin. So hemoglobin is a protein in red blood cells, and its purpose is to transport oxygen to the tissues and also gives red blood cells their red color. So iron deficiency anemia is going to be the most common cause of microcytic anemias, and this is because you need iron in order to produce hemoglobin. So types of microcytic anemias, they can be categorized according to the amount of hemoglobin in the red blood cells, and there's three different big types: hypochromic, normochromic, and hyperchromic. So I'm going to go through each of those and explain what causes those, and just look more in depth at each one. So hypochromic microcytic anemia, it means that the red blood cells have less hemoglobin than normal. So low levels of hemoglobin in your red blood cells, the red blood cells are going to appear pale in color. And so in this case of microcytic anemia, the body has low levels of red blood cells that are both smaller and paler than normal. So most microcytic anemias are hypochromic, and iron deficiency anemia falls under this one. As I said, it's the most common cause of microcytic anemia. Iron deficiency anemia can be caused by inadequate iron intake, usually a result of your diet. So a lot of vegetarians, a lot of iron sources, there's two different types of iron. So there's heme and non-heme. So heme is a lot more easily absorbed, and non-heme is not as easily absorbed, and you need vitamin C to help absorb that type. So if you're not getting any vitamin C, and let me clarify, non-heme is plant-based. So if you're vegetarian, you're going to be eating non-heme forms of iron, so you need that vitamin C in order to absorb that. Other things that can cause iron deficiency anemia is being unable to absorb iron due to conditions like celiac disease or H. pylori infection, so like a stomach ulcer. Chronic blood loss due to frequent or heavy periods in women, or by GI bleeds from upper GI ulcers or IBD, so inflammatory bowel disease, and then also pregnancy. And then, so other things that could cause hypochromic microcytic anemia is thalassemia. So this is caused by a genetic abnormality that involves mutations in the genes needed for normal hemoglobin production. And then sideroblastic anemia. So this is another congenital abnormality in which the body has iron, but it's unable to make hemoglobin. So normochromic microcytic anemia, this means that your red blood cells have a normal amount of hemoglobin, and the hue of red is not too pale or deep in color, it's normal. So this type of anemia can be caused due to inflammation and chronic disease, and you can see it with patients with infectious diseases like tuberculosis, HIV and AIDS, or endocarditis, or you can see it in patients with inflammatory disease like rheumatoid arthritis, Crohn's disease, or diabetes mellitus. And you can also see it in patients with kidney disease and cancer. And this is because these conditions prevent red blood cells from functioning normally, which can lead to a decrease in iron absorption or utilization. Okay, and lastly, we have hyperchromic microcytic anemias, and this means that the red blood cells have more hemoglobin than normal. So these high levels of hemoglobin make your red blood cells excessively red. So hyperchromic microcytic anemia, these type of anemias are very rare and may be caused by a congenital disorder called congenital spherocytic anemia. So in CSA, the membrane of the red blood cells does not form correctly, and it causes it to become rigid and improperly shaped like a sphere. And so these cells are sent to the spleen to get broken down because they don't travel well in the blood system. And then other causes, so this can include lead toxicity, copper deficiency or zinc excess, and then alcohol or drug use. So signs and symptoms of microcytic anemia, these are going to probably start out as mild symptoms if you even experience the mild symptoms. So first you would experience weakness or pallor, and then some symptoms you might not have some symptoms until the lack of normal red blood cells is affecting perfusion to the tissues. So you would experience fatigue, tiredness, loss of stamina, shortness of breath, pale skin, and dizziness and fissures at the corners of the mouth. And some other things that you might see, so a CBC is going to show you the number of red blood cells, but then a peripheral blood smear will show you the size of the red blood cells. So this will help you determine first anemia, and then second whether it's microcytic, macrocytic, and then also serum ferritin levels in these patients are going to be less than 10 nanograms per milliliter. So your normal level is going to be 12 to 300. Treatment. So treatment is going to focus on the underlying cause of the anemia. So say anemia, iron deficiency anemia due to blood loss. You want to focus on treating the cause of the blood loss. In other words, if there's heavy menstrual flow, hemorrhage, GI bleed, or IBD, we want to treat that in order to treat the anemia. So women with an iron deficiency due to heavy menstrual flow may be prescribed hormonal therapies such as birth control pills. And then iron and vitamin C supplements are also recommended, and they're going to usually start with oral. Unless there's a malabsorption issue, then you can go to parenteral. So in cases of severe microcytic anemia, patients may need to receive packed red blood cells in order to increase the number of normal healthy red blood cells circulating. So diet is, since iron deficiency anemia is the most common cause of microcytic anemia, diet is going to be huge because the cause of iron deficiency anemia is a lot of the times not getting enough iron in the diet or vitamin C. So supplements are recommended if you already have anemia or if you're on a vegetarian vegan diet. So some examples of foods rich in iron, it's going to be red meat, poultry, dark leafy greens, beans, and dried fruit like raisins and apricots. And then also, so that iron, we need vitamin C to help absorb it. You need to get vitamin C in your diet. So some examples of vitamin C: citrus fruits like oranges and grapefruits, kale, red peppers, Brussels sprouts, strawberries, and broccoli. Okay. And so vitamin C can help double the amount of iron in your body. It just helps absorb that iron, especially non-heme iron. It's harder for your body to use it and absorb it, so you're going to get less out of it. So vegetarians, like I said, need to add vitamin C into their diet if they're not gonna eat iron from animal products. Okay, so I have some test questions for you all. So question 1, which signs and symptoms does a nurse expect to find in clients with microcytic anemia? And this is a select all that apply. So A, exercise intolerance, B, fatigue, C, glossitis, D, jaundice, E, microcytic red blood cells, and F, paresthesias in the extremities. So the answer to this one would be A, exercise intolerance, B, fatigue, and E, microcytic red blood cells. Okay, question 2. Which meal would you suggest a patient with iron deficiency anemia to order off of a menu? So A, chicken broth, potatoes, and pudding. B, broccoli, chicken breast, and oranges. C, spaghetti, salad, and bread. So the answer to this one would be B, broccoli, chicken breast, and oranges, and that's because broccoli and chicken breast is going to be a good form of iron, and then broccoli and oranges are going to be a good form of vitamin C. The other ones are not. They might have one or two that have a decent amount of iron or vitamin C, but this one's going to be the best option. So question 3, a young woman comes into the clinic presenting with signs of microcytic anemia. The woman reports that her last menstrual period was 1 day ago, and which orders would you expect the healthcare provider to prescribe? This is a select all that apply. So A, an iron supplement, B, a vitamin C supplement, C, magnesium supplement, or D, a potassium supplement. And so the answer to this question is going to be A and B, because you need iron and vitamin C. The woman just had her last menstrual period, so she's lost a lot of blood and a lot of iron. So we need to supplement both of those back into the body. Okay, question 4. What is the most common cause of microcytic anemia? So A, lead toxicity, B, congenital spherocytic anemia, and C, iron deficiency anemia, and D, HIV/AIDS. So like I've said many times, iron deficiency anemia is going to be the answer. Okay, and lastly, question 5. So a young man presents to the ED with signs of anemia due to significant blood loss. Which order would you question from the healthcare provider? A, an iron supplement, B, packed red blood cells, C, a CBC with a peripheral blood smear, and D, a zinc supplement. So the answer is going to be D, a zinc supplement, because one of the other causes for microcytic anemia was an excess of zinc, and all the other ones are going to be very important in determining whether the patient has microcytic anemia and the cause of anemia. So, all right, guys, and that's it. Thank you for watching.